This recording is going to go over Provider Meditech CPOE training for UPMC Cole. When you log into the computer, you are going to navigate to myapps.upmc. When you log into MyApps, you are going to find your Cole Meditech icon. If you are going to be documenting in Meditech without Dragon, you can click on this icon. If you are going to be documenting with Dragon, you are going to want to find the DMO EMR folder. Once you find that, go ahead and click on it. And then you're going to want to click on DMO Cole Meditech. When you click on that, your Dragon Medical One box should open, as well as your Meditech. Your username for Dragon is going to be the same username you use to log into the computer. Once you enter that under User, you can click OK. Your Dragon bar should now be available to you to move around on your screen. Next, we are going to log into Meditech. So on this main screen, you are going to click Enter. You will only have one option for live. And you are going to enter your Meditech username, which should have been emailed to you. Once you enter your username, your temporary password is going to be Memorial7. Once you enter your temporary password, you are going to click Enter, and it should prompt you to enter a new password. Once you get logged in, you are going to select PWM for Provider Workload Management. And then you are going to click on Desktop. From here, we will be working inpatient, which is on the top right. Outpatient would only be used if you are doing surgeries and need to find your patient from the surgical list. So I'm going to click on Inpatient. And this is a list of all of the patients you are covering for. My covering list is at the top. So I have MedSurg 3, MedSurg 4, Nursery, and OB. This will be set up specific to the areas you are covering for. Towards the middle, in the green header, is the location or the unit. So here is the list for MedSurg 2. And on the right-hand side, it will show how many patients are on that unit. Below that, you have their bed and then the date that they were admitted. You have the patient's name towards the middle, their age and their sex, and then you have their visit reason. You have home medrec completed, yes or no. Provider medrec completed, yes or no. The service that they were admitted to. Out of the US in the last 6 months, yes or no, and that will pull in from nursing documentation. You have the status as inpatient admission versus observation. If there is a little O next to the IN, that will indicate that they were here for observation. Tele in the last 48 hours, yes or no. Length of stay, and then in the top right, it will show their medical record number. We are defaulted to our rounding list. The other button you will use on the right-hand side is Find Patient. And you will only use that button if you are trying to manually search for a patient that has already been discharged. Just make sure you select the correct patient and the correct encounter. So I'm going to scroll down until I find the patient I am looking for. So I'm going to use Test Child. Once I find the patient, I'm going to click on them to highlight them in blue. Once I click on them, my buttons at the bottom are available for me to click on. The first button I'm going to click on is Review. If you have any new results on this patient that you have not seen yet, over on the right-hand side, they will be highlighted in blue. Mine are all black because I've already reviewed everything on this patient. Top right is Patient Summary. This is an overall picture of the patient. I also have a demographics tab. If I click on that, I can click on the blue plus signs on the left-hand side to get more information about my patient. Under patient summary is problem list. This includes ICD-10 diagnoses codes. You do not have to document them here, but you can. However, it is mandatory to enter the problems attached to the status order. So when you enter your admission orders or order sets, you will include the problem list then. Under problem list is special panel, which we do not use. Daily review is next. Mine is grayed out, just meaning I don't have any information under daily review. This is a catch-all spot for all information collected on the patient on that day identified. Order history is next. This is a history of all orders placed on the patient. I can break it down a little bit further. I can put them in order by service date and time. So if I click on this blue header, it will put them in order. Same with procedure and category. It will alphabetize them if I click on the blue header at the top. Anywhere in gray, you can click for more information. So I can click over here in the gray on the left-hand side to get more information about this order. Top right is your back button. Under order history is vital signs. This includes documented vital signs. Again, anywhere in the gray, you can get more information. If I wanted to see all of the blood pressures, I can click on blood pressure, and it will show all the blood pressure since this patient has been here for this visit. I&O is next. This is your intake and output documentation, and you can change your time frame at the top, 1 hour, 4, 8, 12, and 24 hours. Lab is next. It is broken out into different headers. My patient only has a urine resulted, which is why I can only see urines. Everything else is grayed out on this patient, just meaning there's no results under those categories. Anything in yellow is abnormal, and your white is normal. Microbiology is next. You can click on the gray field to pull up the final report. And then your back button is at the bottom right. Blood bank and pathology are next. They are grayed out, just meaning, again, I don't have any results under those categories. They do operate the same as the lab and microbiology. Anywhere where there is gray, you can click to get more information. Medications is next. This is a list of medications ordered this visit for this patient. It does show active, discontinued, and all medications. Again, anywhere in the gray, you can click to get more information on that medication. Imaging is next. You can click on the gray exam under the date and time for the report. In live, under IMG for imaging, you will have a yes or a Y. You can click on that Y to open up the image in Synapse to view the image. Next, we have other reports. Scanned reports go here, as well as dictated reports. Your ED documentation is also going to be found in here. You can click on the gray date on the left-hand side to view the report. Below that is notes history. You will find provider physician documentation from CPOE in here, as well as physical therapy, occupational therapy, speech therapy notes, and nursing notes and case management notes. The date gray area pulls all notes from the entire day over here. The radio button on the right only pulls that specific report. Below that is assessments. This is all nursing assessment documentation. You can click on the gray field. Anything in blue is what was documented. Same with this, you can click on the blue headers to put them in order or to alphabetize them. Reconcile meds is the next one we are going to cover. This will take you to the MedRec screen. So this patient has 4 home meds. If I click on the 4 home meds, it will show me exactly what they are taking. You will DC, continue, or hold the medications. Once you select the appropriate action, you will click Submit when you are done. Return is in the bottom right. The next one is Other Visits. This function allows you to toggle between different visits to see results, documentation, and note history. You can filter it by time frame, visits, or you can select a specific visit at the bottom by putting a check mark in the gray box and clicking Selected. Patient List is the last one, and this will take you back to your patient rounds list.